Hi, Dr. Yass here. I want to just talk about where people find themselves in this day and age when chronic pain is a global epidemic and probably without question the number one health issue affecting the world's population. And it's just become such a moneymaker. It it brings in over $700 billion a year just in the United States alone. And as far as I'm concerned, because of this, you have individuals out there who are trying to appeal to people based on the emotion that they don't think that their pain is ever going to be resolved. So they'll be willing to try just about anything. And all you have to do is basically just go on Facebook or Instagram and look at the sponsored ads that exist. It's almost like every second or third ad is an ad for some mechanism, device, treatment to address chronic pain. And I think that there's a great comment that was made by George Orwell that really pertains to today. And he basically said, in a time of deceit, telling the truth is a revolutionary act. In a time of deceit, telling the truth is a revolutionary act. And I want people to recognize that in developing the Yass method and trying to create awareness of it, clearly I am going against the global medical behemoth. But beyond that, I'm also going against every type of charlatan who's out promoting some nonsensical device or piece of equipment or treatment. And it's almost insane at this point, and it's very scary, I think, for the average person who's out there. I look at the comments that people write in these areas, and if you ever just looked at the comments, you would see that everybody's suffering from the same situations, especially when it comes to the neck and back issues. And what is it that you see? You see that everybody sees themselves as the diagnosis they've been given. Every single comment that you see relates to something like I'm an L4 L5 nerve root impingement, or I'm a failed L5 S1 fusion. I'm a herniated disc, has been suffering for 10 years, failed with multiple surgery. Everybody sees themselves as the diagnosis they were given, and as a result of that, have psychologically connected their pain to the diagnosis without ever being in a position of questioning whether that diagnosis is even valid or whether it even represents the tissue in distress creating the symptom they're experiencing. From day one, they were doomed to the situation they find themselves in. Think about the premise. The use of the X ray or MRI has been around for 40 years, and the number of people suffering from chronic pain has not done anything but gone up. The extent of time that people are suffering has done nothing but gone up. The cost to treating chronic pain has done nothing but gone up. Why do you think that is? Why do you think that is? Clearly, there is something systemically wrong in the way that the medical system attempts to address pain. Well, is it that they're phenomenal at getting the proper diagnosis to tissue in distress, and they just suck at treating it? You think that's what it comes down to? Because clearly something's wrong. All you have to do is go on Instagram or Facebook and look at these sponsored ads and look at the people commenting, and everybody's in the same boat. Failed this, failed that, failed this, failed that. I've been suffering for years. I've been suffering from decades. I've had multiple treatments. I've had multiple surgeries. It's the same story. All you have to do is look and see. So what's the answer? What's the answer? If you think that you're getting the right diagnosis and just not getting the right treatment, that's a bit confusing. That should make you take pause. You think that they figured out what tissue is in distress, but they just can't figure out how to resolve the distress of the tissue? Well, that's not true because they have attempted to say that the tissue in distress is what was found on the MRI, the herniated disc, stenosis, pinched nerve, meniscal tear, labral tear, compression fracture, any of this type of stuff. And that's what they're treating. So it's a little hard to say that you're getting the right diagnosis and the treatment sucks. It should make more sense that you're getting the wrong diagnosis. And this is, I understand, this is hard for people to wrap their heads around. I clearly understand that. You go to an organization that you think is in a good position to help you establish the cause of pain. You go there with good faith, thinking that they're properly educated and trained and have your best interests at heart. And yet, you come out with a diagnosis and treatment that doesn't resolve your pain. So you have to start. This is one of these gigantically huge pivotal situations people find themselves in. 40 years using the MRI, being promoted as the gold standard for diagnosing and treating pain, used globally, and yet every bit of evidence, theoretical, clinical, and scientific evidence says it doesn't work. All the treatments based on the diagnoses have not worked. How do you know that? We just talked about the fact that the numbers of people suffering from chronic pain has skyrocketed, never gone down. The length of time has never gone down. You've just come out of an opioid epidemic, and the only reason you still don't have an opioid epidemic is because instead of addressing why people require the opioids, they simply stopped the availability of the opioids, which then led to a medical marijuana problem that now has arisen. And beyond that, you have these people promoting this radio frequency ablation nonsense, the burning, cauterizing of your nerves. Who thinks that's going to make your pain go away? And then you have the massive number of people who have been left after all the treatments, all the surgeries, to either be addicted to prescription pain medication, where they have to try to find it, if not through the medical system, on the black market, or they're simply told there's nothing left for them to do, and they simply have to suffer in pain for the rest of their life indefinitely, which, take a wild guess what that has done, has caused a rise in the cases of depression and suicide. I mean, it's just so evident where all this has gone. And it's not like these people are hidden out of society. I think everybody on the planet knows somebody who's had a failed back surgery, hip or knee replacement. I think it's pretty evident. Shoulder replacement. I think it's pretty clear it's not working and everybody knows them. But what's the difference? The difference now is that chronic pain has become acceptable in the equivalent idea of chronic illness. Society now accepts that pain is a part of life. It has to be that way. It has to be that way. The surgeries fail. As far as everybody knows, they're the right surgeries treating the right tissues. The medication you can only stay on for so long. It's heroin, synthetic heroin. It's quite addictive. And if you can't find somebody outside of the medical establishment to resolve your pain, you're pretty much stuck, which is the very reason that you have these psychotic charlatans coming on television to promote crap, coming on Facebook and Instagram, radio, everywhere. It's everywhere. Every type of little pain supposed treatment can be found. Every form of media that's available to you. And the overriding thing that you'll notice is that nobody's talking about the principles of pain. That to me is the funniest and saddest part at the same time. You, as an individual suffering with chronic pain, must recognize that you don't treat the pain. Pain is an indication of a tissue in distress. It's a signal. It's not an entity. It doesn't exist. It's not your kidney. It's not your liver. It's not your spleen. It's simply an entity that doesn't exist. It's a signal. It's in the air. And all it's trying to do is create conscious awareness of the stress of the tissue that's eliciting it. The tissue is trying to make you aware that it is not functioning properly, and therefore it warrants an intervention. Please, please, please recognize I'm not working. Please get somebody to help me resolve the distress I have so I don't have to elicit this emergency signal any longer. And once the proper intervention is provided and the distress of the tissue is ended, it doesn't elicit the emergency distress signal of pain any longer. So if you were to understand that, you would understand that you don't treat pain, which is what every schmuck on the internet is trying to promote. You have to treat tissues, and you have to be able to diagnose what tissue is in distress. Right? Does this make sense to anybody? Is this logical? So how do you identify the tissue in distress? Do you use MRIs and X-rays? Well, clearly that's baseless, and more importantly, one of the key possible causes, muscular causes, doesn't show up on diagnostic tests. Think about that. Over 28 years and thousands of people have shown that in greater than 98% of cases, the cause of pain is muscular. This can present as a muscle straining and elicit pain. This can present as a muscle altering the position of a joint surface like the kneecap and causing it to rub in a way it shouldn't. So you end up with joint pain coming from a muscular deficit. Muscles refer symptoms like having numbness after you sleep on your shoulder. That's a referred symptom from a rotator cuff muscle. And muscle can impinge on a nerve and cause the nerve to elicit a symptom. So you have a muscular cause creating a neurological symptom. That's sciatica. So those four mechanisms account for roughly 98% of all cases of pain. Where are you going to get that as a possible cause of your pain? Certainly not from the MRI, the X-ray. They don't show up. Are anybody in the medical establishment educated and trained to identify muscular causes? No. They're in hook, line, and sinker to the use of diagnostic testing. So now, with that bit of information, now you start to try to make sense of why you're still having chronic pain. Well, you've used an improper diagnostic model, the X-ray or MRI, that can't identify all possible causes of pain. And it turns out that in more than 98% of cases, the cause of pain is a tissue that can't possibly show up on diagnostic tests, and no medical practitioner is educated or trained to identify. Doesn't that sound like a possible reason for chronic pain, a global chronic pain epidemic? An improper mechanism to diagnose the cause of pain, and a medical establishment unable to identify the tissue in distress that is in distress in more than 98% of cases of pain. Right? So, with this understanding, which is logically based, entrenched in scientific understanding, the theoretical basis for it is there, the clinical presentation is there. So when we talk about the clinical presentation, we can say that we have these people, they come in, they present with a symptom. We could say, let's go back to the knee. It's one of the easier ones to understand. Pain around the kneecap. They get an MRI. It shows that they have a torn meniscus because the torn meniscus is identified at the time of pain. It's asserted to be the cause of pain. You can go to anybody you want, any type of practitioner. They're going to look at that MRI and say, torn meniscus, pain, torn meniscus causing pain. End of story. You need surgery. The problem with this is that the meniscus lies between the thigh bone and lower leg bone, which is a specific joint, and you would have to feel that at the joint line, which is on the side of your knee. It turns out that there's a separate joint, the joint between the kneecap and the thigh bone. That's a completely separate joint. So how could someone say that the meniscus lying in one joint can cause pain in another joint? This is logic. This is being entrenched in science. All right? So how could a structural variation at one joint create pain at another joint? The answer is it can't. It can't. So the answer is I don't really care if a meniscal tear was found. If your pain's around the kneecap, it can't be from a meniscal tear. Therefore, that meniscal tear is most likely degenerative. It's been there for years. I'll resolve your knee pain. And if you took an MRI in 10 years from now, the 10 years you've had no pain and have been fully functional, 10 years later, we'll take an MRI, you'll still see that meniscal tear. It's degenerative. It's just sitting there. It's not inciting any symptom. It's an independent variable. You could do this anywhere in the body, and I will show you that in 99.99999% of cases, the cause of pain that's being identified by the MRI or X ray is not the cause of pain because the symptom being experienced is not the symptom you would expect to be experienced if the structural variation were to elicit pain. I'll give you another one. Really obvious, very obvious. You get these older people and they're having pain 2 to 3 inches on either side of the spine, and they get an x ray and it's found to have a compression fracture of the spine. And they're told, well, the compression fracture is found at the time of their pain, therefore that must be the cause of their pain. And they want to treat, I mean, like they want to do surgery on this stuff, or they want to inject cement into the fracture site. Go back and think of the premise. The person is complaining of pain 2 to 3 inches to either side of the spine. They're being told that a compression fracture in a vertebrae at the spine is the cause of the pain. Where would a compression fracture most likely elicit pain if it were to be in distress, as with a compression fracture? I don't think you have to be a rocket scientist to know that it would create pain at the vertebrae where the compression fracture exists. Is the vertebrae 2 to 3 inches on either side of the spine? No, it is the spine. So, how can a compression fracture of a vertebrae that's located as part of the spine create pain 2 to 3 inches on either side of the spine? The answer is it can't. Now, you could go to somebody and they could just simply say, well, it's referred there, it's referred there. And you being the person you are, how would you possibly know? If they say it could be referred, you got to accept that. I'm telling you, bones don't refer symptoms. That's natural law. That's natural law. That's been understood since the history of mankind. So you have to start saying to yourself, this system that exists that you keep going to try to address your pain has failed so freaking miserably that the number of people suffering from chronic pain has skyrocketed. The length of time that they're suffering has increased. The intensity of pain has increased. The amount of money being spent has increased. The failure rate for back surgery has done nothing but increase. They have created the diagnosis failed back surgery syndrome. The number of revisions being performed on hip and knee replacements is now greater than the initial hip or knee replacement. You've gone through an opioid epidemic. The number of people suffering from depression and suicide has skyrocketed. And you want to continue to accept whatever they tell you simply because they tell that to you? God bless you. That's all I could say is God bless you. If you're willing to do this, then my opinion is I don't think you're really looking for the truth. You just aren't looking for the truth. Because clearly the truth is not being told. I, for whatever reason, went to school to become a physical therapist through the system, and almost within weeks recognized that everything that was being said was baseless, not logical, not entrenched in science. I decided I was going to go beyond it and teach myself and understand the natural laws of the body, how the body works. And that's what I did. And I was able to create the understanding of how to interpret what tissue is in distress based on the presentation of the symptoms that are being created, because it is the tissue in distress that's creating the symptoms. And it turns out, in more than 98% of cases, I was able to see that the cause was muscular. One of the key indicators was the fact that everybody keeps telling me that the thing that seems to bring on their pain is activity. I get my pain when I stand. I get my pain when I walk. I get my pain when I go up and down stairs. I get my pain when I kneel. I get my pain when I sit. I get my pain when I reach. Everything, every single thing, every activity brings on the pain, and somehow when they rest, the symptom seems to decrease. How could anyone say that the tissue in distress with that understanding is not muscle, that it's some structural variation identified in an MRI? I guess you're willing to believe that during the activity, the structural variation exists, but when you rest and you don't have the pain, it disappears. So it just comes and goes, is what you want to believe. At some point, when you've had so long of failure in the ability to resolve your pain, you have to start saying to yourself, something's wrong in the way this is being approached. And the answer is there is no logic. That's the problem. Quite simply, there's no logic to it. It's an arbitrary organizational precept that we use the X-ray and MRI, and whatever we find, that's what we're going to treat, and that's the end of the story. It's a almost monopoly-like situation, so you don't think there's any alternatives, right? It's a fee-for-service basis, so outcome is not a factor in getting paid, right? So if you have pain at your back and you get a 3 or 4 level fusion for a couple of $100,000 and your pain is just as bad, if not worse, does the doctor get paid? Sure as shit they get paid. Of course they're going to get paid. Doesn't matter outcome. And when outcome is no longer a factor in getting paid, as long as I can get paid, why do I care whether you get better? Why do I want a positive outcome? It's more beneficial to me to not have a positive outcome, right? Every single thing, when you look at this entire situation, you will see that everything is against you. Everything is in a situation that allows you to remain in pain indefinitely. It's indefinitely. So at some point, you personally are going to have to make the decision as to whether you want to continue in this process, you want to go on YouTube and Instagram and Facebook and look at schlocky things which promote treatments. It's always a treatment, but never attempt to identify the tissue in distress. The only way to do that is through a physical evaluation and a presentation of a history, which is at the core of the Yass method. I am not familiar with any other method out there that is both a diagnostic and treatment model. There's lots of treatment models, chiropractic adjustments and acupuncture, and you could do massage, and you can do, Pilates and yoga and lots of stuff where they say just do it and see if it makes your pain go away. But that doesn't follow the scientific model of understanding what is fact and what is not. The scientific model says you need to come up with a diagnosis before you could treat anything. Before you treat anything, you got to know what you're treating, which is to say you have to know what tissue is in distress. Bone, nerve, muscle, right? You got to be able to identify it. How are you going to identify it? Well, the planet seems to be willing to go with this nonsense about the diagnostic testing, X-ray and MRI. And for those, when those failed, you got those lovely people out there willing to schlock their nonsense, right? And unfortunately, in your particular case, because you are so emotionally distressed, you are so anxious, you are so frustrated, you are becoming disillusioned, you're becoming hopeless. You are fodder for these people. That's why they have sponsored ads. That's why they have them. They're going to put it out there in places you are, where they're going to put up these ridiculous concepts of be pain free, just do this, just be pain free, breathe in and you'll be pain free, touch this and you'll be pain free, put this on and you'll be pain free, do this, touch that, go to them. And yet, if you just ask the very first question you would need to ask to resolve your pain, which is, how are you going to differentiate what tissue is in distress creating the symptom? That is in no way part of the conversation. There is no conversation about that. And yet, without that, you got nothing. You got nothing. Which is why you'll remain in pain and you'll just keep pissing away your money. And it's sad. Trust me. It's so hurtful to me. It's devastating. And that's why I'm on. That's why I'm on YouTube. That's why I do Instagram posts and Facebook posts. But you'll notice that none of this is sponsored and none of it is schlocking anything. The majority of what I do and say is trying to profess an understanding that's based, again, on science, theoretical, clinical, and scientific evidence, based in theory, right? Based in an understanding that I assure you, I'm ready to go. I'm ready to go in front of anybody and be challenged and see if they could find even a hitch in any of my theory. And the answer is it can't be. It can't be found false or inappropriate or not true. It is 100% true because it is based in natural law. It is the way people have perceived how to address pain for thousands and thousands of years. Way, way before there was diagnostic testing. When the technology didn't exist, how do you think they figured out what was causing your pain? They had to ask you lots of questions. They had to do a thorough physical evaluation. That's how you got the answer. You want? Go back to Hippocrates. Check out some of his writings, and you'll see that's what he talked about. He knew that you needed to understand the history of the symptom and then understand the physical presentation of the symptom. How are you going to get that in today's society? Well, the answer is you need to get a Yass Method Zoom session. That's all I could tell you. The good part, you don't have to come to Jacksonville, Florida. You just go to my website, livewithoutpains.com/sessions, and you could schedule a Zoom session in the comfort of your home for any day and time that's available for you. How tough can this possibly be? You make an appointment, you get the session, we evaluate you, establish what the cause of pain is, the tissue in distress in 98% of cases or greater, it's going to be muscle. And so we're going to figure out it's muscle. We're going to show you how to do some exercise. You're going to then follow and perform the exercise under my supervision. The session's a videotape. You make sure you use the videotape going forward to make sure you perform the exercises properly with the appropriate resistance during your exercise bouts, which are no more than 3 times a week for 4 weeks. You then get a follow-up session. We check, make sure everything's going in the right direction. You get another videotape to follow. And so you're constantly being supervised to make sure you're doing things correctly. If it is muscle, there's only one way you're going to resolve a muscular cause of pain, and that is to increase the strength of the muscle until its force output is greater than the force requirement of your activities. Right? The lack of strength is why you're having symptom. So massaging it, putting a salve on it, putting electric stimulation on it, wearing a holster to stop using it, to relax it, all this stuff is clearly nonsensical. Again, science tells you this, not me, science. I am a student of science. I profess science. I am not telling you to follow what I say. I'm telling you to look at the information, and if it makes sense, follow it. So that's what I have to offer. And as far as I'm concerned, as it says, in a time of deceit, telling the truth is a revolutionary act. And I do think this is revolutionary. And I am looking to create a people's revolution. I am looking for people to be willing to come to this path, see the truth in it, use it, implement it, achieve a pain free, fully functional life, and spread the word to their family, friends, and coworkers, and see if we can slowly, one person at a time, pick off the medical establishment until it's simply non-existent, until enough people recognize that it's baseless. It's baseless. It doesn't matter how long it's being used for. Doesn't matter how many people use it. The fact is, it's baseless. And I could always, the easiest way to understand, just go back to George Washington. George Washington was killed by his doctors. Irrefutable. Go to the Smithsonian Institute in Washington. You'll be able to see the tools that they used to bleed his neck, which led him to suffocate, and he died. Now, I'm sure the idea of bleeding, if you went back and looked at history, I'm sure the idea of bleeding had been around for hundreds of years. Hundreds of people were bled, and I'm sure died, got greater infection, lots of bad stuff happened. But at the time, it was thought of as the way of treating infection. And yet, it's insanity, lunacy. You just have to look at evidence. That's the name of the game. You got to look at evidence. Look at the evidence about the use of X-ray or MRI to identify the cause of pain. It's basically end of story. There's nothing to really discuss. It doesn't work. Every bit of evidence is there. It doesn't even have a theoretical, clinical, or scientific basis for it. And yet it's continued to be done. And again, as I said, listen, as long as it's a fee-for-service basis, as long as these practitioners get paid regardless of outcome, I am sure they're extremely happy. And I am sure they have no intention of changing anything. It is what it is. Now it's up to you. You make the choice. You decide. What do you want to do about your pain? If you're ready to go to the process of understanding what tissue's in distress so you could resolve the distress of that tissue so it no longer has to emit the emergency distress signal of pain, get the Yass method. That's the answer. Like I said, go to the website, www.livewithoutpains.com/sessions, or you could email me at drmitch@mitchellyass.com. For now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye for now.